A question that I'm often asked about is what are the best ways to train and possibly make muscle and strength gains if you're over 50 years of age? A lot of men wonder about that. They wonder if it's possible to still build muscle past the age of 50. Other men, for example, might have trained when they were younger. They might have been involved in regular resistance training, but with age, maybe they had married, had kids, or whatever. They felt that they didn't have enough time to work out, so they stopped training. And then, of course, as they get older, they see the effects of not exercising, increased body fat, possibly certain adverse medical changes, possibly higher blood pressure, bad lipid levels, those are stuff like cholesterol and triglyceride in the blood. And they want to get back into exercising, but they wonder what precautions should be taken if you haven't exercised, especially with weight resistance training, in many years. I mean, is it safe? Is it still possible to make some of the gains you made when you were in your 20s or something like that? So I'm going to try and answer some of these questions in this video. Now, the first thing that I think a person should do, if you're, let's say, over 50 years of age and you haven't been involved in any type of exercise for many years and you've been largely sedentary, meaning you don't engage in a lot of physical activity, you don't walk a lot or do anything like that, I think it's a good idea to have a physical examination by a medical doctor and also to have lab tests. Now, in the lab tests, I think it's important, if you're over 40, to check your testosterone levels. That means total testosterone, free testosterone, and also estrogen levels. The type of estrogen test you want to have is called a high sensitivity estrogen test, because the usual estrogen test is more specific for women. It's not accurate for men. The only type of estrogen lab test you should get is called the high sensitivity estrogen test. That can be done for men or women, but it gives you a better picture of your estrogen level in men. So you have your lab test. If everything is normal, and you want to go back to the gym, you don't want to go crazy. There's certain things to consider now. As far as gaining muscle, that's an interesting controversy right now, because some of the textbooks will point out that the older you get, the harder it is to build muscle. Now, why is that? Well, there's several reasons for it. But before I answer that question, I just want to point out that this is a very important point. Put this in bold letters. If you don't, I don't care whether you're a man or a woman, if you don't engage in some form of resistance training, whether it's with weights, machines, those rubber band things or whatever, even some isometric contractions like Charles Atlas movement, if you don't engage in some type of resistance training, you will inevitably get a condition called sarcopenia, which is a loss of muscle mass related to age, because your muscles are machines. If you took a car and left it in a garage for 20 years and never tuned it up, never turned it on or drove it, it would rust and fall apart. And the human body is basically a machine that works on the use it or lose it principle. Whatever isn't used is lost, and that includes muscles. Muscles have to be activated to basically maintain their tone, shape, and strength. So you have to do some form of resistance training. I just want to say that right off the bat. You don't have to go crazy. You don't have to train like a bodybuilder. You don't have to spend hours in the gym. Believe it or not, you can train as little as twice a week with, let's say, resistance training, and you could still get most of the benefits from weight training. We're talking about people that are not trying to compete in a contest like a master's contest. You just want to build some muscle or maintain some muscle. If you want to train more often, you could train, let's say, a couple of days a week, and you could train each muscle once a week, but you would have to do a little bit more volume. As long as you could train twice a week, you could do a little bit less volume, meaning the total number of sets and reps. But anyway, so as far as building muscle, I skipped over some. I'm sorry. The reasons why it's harder to build muscle. as you age has to do with certain changes that occur in the body. Now, one of these involved muscle stem cells known as satellite cells. Satellite cells are located in the muscles, and what they do is they're, as I said, they're muscle stem cells, and they're involved in the repair and growth of muscle. A lot of times, if you haven't worked out for many years, the satellite cells more or less disappear. They kind of, you have fewer satellite cells. Now, satellite cells normally are quiescent. In other words, they're in a resting state most of the time. They're only activated when there's either damage to the muscle, and damage could include the damage incurred by resistance training, because when you when you lift weights, there's a certain amount of muscle damage that's placed on muscle fibers, and when that happens, the muscles sense that, and the satellite cells are activated. They're activated through numerous pathways. One of them involves a intramuscular hormone called insulin-like growth factor 1, which is also produced in the liver. Now, the IGF-1 that's produced in the liver doesn't really affect muscles that much. The IGF-1 produced in the liver is more of a systemic hormone that affects, let's say, heart muscle health, the health of the neurons in the brain, and the maintenance of connective tissue. So, systemic IGF-1 is important, but it's the intramuscular IGF-1 that's the truly anabolic form. And that's activated by exercise, when you damage your muscles, intense training, whatever. The IGF-1, which actually has 3 variants in muscle. There's 3 variants of IGF-1 in muscle. One of them is called mechano growth factor. And what these things do is they stimulate the activation of satellite cells in muscles. And it causes a differentiation of satellite cells. I don't want to go into the physiology of satellite cells, but let's just say that they work by contributing myonuclei to muscles, which increase muscle protein synthesis. And I don't want to get into it too much, but that's the relationship between satellite cells and muscle growth. Unfortunately, if you don't exercise, especially resistance training, as you get older, there's a possibility of losing satellite cells, and if that happens, it's going to be harder to make muscle gains, because, as I said, satellite cells are involved in muscle hypertrophy, although some scientists believe that they're not as important as people think. I kind of disagree with that. The bulk of research I've seen on satellite studies suggests that they are important for stimulating muscle growth. So one of the factors that inhibit muscle gains, let's say past 50, are a lack of satellite cell activity. Now, the good news is that in most people, even satellite cells that haven't been activated in years, if you start to engage in regular resistance training, you can actually reactivate them. In fact, they've shown in people, really older people, let's say over 65, 70 years old, that these people can actually reactivate satellite cells by doing aerobic exercise. Even walking on a treadmill will reactivate their satellite cells, which is great for maintaining muscle. And that's very important, because when you lose muscle, when you get sarcopenia, it greatly increases what they call all-cause mortality. All-cause mortality. Thus, it increases your risk of death from all kinds of reasons. Cardiovascular cancer, all these things are increased by a loss of muscle mass with age. Now, the other factor that explains why it's harder to build muscle past 50 has to do with the loss of what they call motor neurons. Now, motor, in this instance, doesn't refer to having an engine in your body, although muscles are often considered engines. In other words, they make you move. They're considered the human equivalent of engines. Now, the motor neurons are, as the term implies, are nerves that stimulate muscle activity. Your motor neurons activate your muscles on a molecular level. This happens at something called the neuromuscular junction. This is what happens is you get your brain transmits nerve signals that goes down the body or the spine, and it goes into the muscles, into the and it activates the neuromuscular junction. And what happens is a neurotransmitter called acetylcholine is transmitted from one end of the mild neural junction to the other, and that transmits nerve signals that activate muscle contraction. Right now, with age, you lose motor neurons. They've shown in studies that this seems to happen first in the extremities, especially the legs. The old saying that the legs go first has a large element of truth. In fact, if you look at a lot of elite bodybuilders, when they make comebacks after many years, a couple of them, Flex Wheeler, Kevin Levrone, they made comebacks when they were over 50 years old. They tried to return to competition. Kevin entered the Open Mr. Olympia. I believe that Flex entered the Classic Olympia competition. And while they did show a lot of actually pretty significant muscle in their upper body, both of them showed a significant loss of muscle in their lower body. In other words, their legs did not look the same as they did when they had competed years before. Now, in the case of Kevin, I thought that it might be due to this motor neuron effect because he was something, I forget, I think he was 52 or something when he competed, but he called me on the phone about 2 months after he competed in the Olympia, and he explained to me that what happened was he injured himself about 3 months while he was training for the Mr. Olympia. He injured, I think it was his knees, I don't remember, or thigh muscle, I don't remember, but he couldn't train legs at all for the last 3 months prior to his Mr. Olympia appearance, and that accounted for his, let's say, less than optimal thigh development. Now, as far as Flex goes, that I didn't really talk to Flex about his legs, but I would assume that it probably has to do with the motor neuron effect, because in the average person, the motor neuron loss in the thighs, it can be as much as 40%. 40% of motor neuron activity in the legs is lost when you get past, by the time you hit about 50 years old. And again, the loss of motor neuron activity, it makes it much, much harder to fully work the muscles and stimulate muscle growth. Now, the good news is that if you continue to work out, let's say you've been working out since you're 20 or whatever, and you're still working out when you're 40 or 50, you're still going to lose motor neurons. It's inevitable. There's no way of totally preventing that, but the motor neuron loss with regular resistance training will be much less compared to a person who does no resistance training. And as far as the mild neural junction, it's the actual area in the muscle that transmits the neuron signals that cause muscle contraction. Well, apparently there's ways of slowing that down substantially, so you can maintain let's say the efficiency of the mild neural junction. It can be done nutritionally, and that's going to be the topic of an upcoming article in my Applied Metabolics publication. This will be extremely useful information for anybody who's over 40 years of age and wants to either build or maintain muscle. Now, another question that pops up is, well, let me just backtrack a little by saying that if you start to engage in regular resistance training at, let's say, 50 years of age, you will actually improve your ability of motor neurons to promote muscle contraction, and you'll also could possibly reactivate a large percentage of your satellite cells. Some satellite cells, just like the motor neurons, will be inevitably lost with age, but there'll still be enough where you could possibly make some muscle gains and at least maintain muscle that you do develop. Now, another question that pops up is, what's the oldest age where you can still build muscle? Now, I used to tell people that the cutoff begins, it starts to happen, the slowdown in muscle gains, let me put it this way, begins to occur around 40 years of age. Around 40, testosterone levels, testosterone levels start to decline in men at age 30 at a rate of about 1% to 2% per year. So some men, by the time they hit 40, are showing substantially lower testosterone levels. And testosterone is important for muscle growth. So if your testosterone levels are too low, you're going to have a difficult time gaining muscle. Now, not all men show low testosterone levels at 40. It's an important point. About half of men show, let's say, clinically deficient testosterone levels by the time they hit about 40, 45 years of age. And those men might want to consider going on some form of testosterone replacement therapy if they want to make muscle gains. If they're not concerned with that and they're not having any symptoms related to low testosterone, then they don't need to go on testosterone at all. Another thing to consider is there's a tendency to gain weight and body fat with age. Now, a lot of people say it's because your testosterone gets lower as you get older. Recent studies have shown that the resting metabolic rate does not decline with age, as popularly believed. That's a myth. It doesn't happen. However, losing muscle with age will lower your resting metabolic rate. What happens really is that a lot of it is due to, again, a lack of testosterone and, especially a lack of resistance training and a loss of muscle. Now, with the lowered metabolic rate that starts to hit at about age 40, especially with loss of muscle, again, a loss of muscle doesn't really happen if you're still working out or engage in resistance or aerobic training. But if you're sedentary, you will notice a gradual drop in resting metabolism. What's going to happen then, if you're eating the same amount of calories, if you haven't made adjustments in your diet, your physical activity will get even lower as you get older. People move less. Some of them have arthritis. There's various reasons why people aren't as active as they age. But when that happens, if you're eating the same quantities of food, the calories will, of course, be stored as the superfluous or extra calories that are not being used in physical activity will be stored as body fat. Now, the problem with that is having a higher body fat level often leads to low testosterone levels. So a lot of men who are tested and shown to have low testosterone levels, very often it's related to having excess body fat. If these men go on a diet, now what type of diet they want to use is up to them, but if they go on a diet and reduce their body fat level, even without doing resistance training, their testosterone levels often return to normal levels, making the need to go on testosterone unnecessary. So that's the first thing we want to do is if you have too much body fat, reduce your body fat level. If you are tested and you show very low testosterone, you probably want to consider some testosterone replacement therapy if your goal is to gain muscle, because it's very important to have a certain level of testosterone to gain muscle. Now, as far as as I said in the past, what I said, and I noticed it in myself and others, that I was making pretty good strength and muscle gains. In past, I wasn't on any type of testosterone steroid, but I trained very hard, trained very regularly, all the way in my 40s. I was still making very good gains. I was still very strong, 45, 46 years of age. I was still lifting heavy weights very strong. I noticed a change occurred about age 50. I started to my strength started to gradually decline. And by the time I hit about 55, it became very difficult to make muscle gains. And now I'm a guy that's been training since I was 12 years old. I've never stopped lifting weights. So in my case, it wasn't a question of loss of satellite cells or motor neuron problems, although I think knowing how motor neurons work, I think there still was a little bit of a lessened activity of motor neurons, and that's what largely accounted for my slowing of gains when I hit about 55 years of age. Now, these days, at my age, I'm not even trying to make muscle gains anymore. My goal these days is only to maintain whatever muscle I have, because I want to prevent sarcopenia, because I know how dangerous sarcopenia is, and it's definitely a harbinger for death. So I lift weights strictly for health now. Now, what my system is what I recommend for a lot of men over 50, especially men who are just coming back into working out, or even if you have been working out for consistently like I have. So this is the system I recommend. They've shown in studies, it started with younger men. Well, actually started with older people. They were trying to figure out a system of resistance training that would help older people to prevent sarcopenia. And these people were not bodybuilders. They were not former athletes. They were all messed up. Most of them weren't. They had limited mobility. They could barely move. They used walkers. They were into heavy sarcopenia. These people. They were looking at death. Some of them were as old as 90 years of age and older. And they tried to figure out a exercise system that would allow them to at least maintain muscle. They didn't expect any muscle or strength gains at that age for the reasons I mentioned earlier. So they put them on a weight training program, mainly stuff like leg extensions, minimal exercise program with weights. And they were surprised at how effective this program turned out to be. The older people, because of their frailty, could not lift heavy weights. I mean, we're talking weights like 5 pounds, maybe 10 pounds at the heaviest, very light weights. And they did, like, let's say 8 to 10 reps. The researchers who conducted these initial studies were shocked to find that the older people, not only did they maintain muscle, if they stopped losing muscle, some of the older men who had been using walkers for years, who couldn't even stand up from a sitting position, were now able to discard their walkers and were able to walk freely. They got all their mobility back. And some of the older people actually made some muscle gains, which absolutely shocked the researchers. They didn't expect that. So then they decided what the system they used was higher repetitions with lighter weights. And then they modified that to using lighter weights, higher repetitions averaging 25 to 30, with weights equal to only about 30% of one rep max, which is very lightweight. That's like a warm-up weight. And they noticed this worked very well for people that were over 60 years of age. It maintained their muscle, and some of them actually made muscle and strength gains training in that manner. So then they decided to try it on younger people. With younger people who don't have the same problem as older people, in other words, these younger people have all their satellite cells working. They have, the muscle motor neurons are working at top efficiency, and a lot of them just work out regularly. Could they also make gains by lifting lighter weights with higher reps to failure? So they took two groups of young men. These are men in their 20s. One group, they had them use a routine that emphasized lighter weights, repetition range of 25 to 30. Again, about 30 to 40% of one rep max was the amount of weight used. And they did each set to failure. They did about anywhere from 1 to maximum 3 sets per muscle. That's it. But it was very important that they trained to failure with using high reps. This increased something called metabolic stress, which is considered a stimulus for muscle growth. And so one group of young men trained in that manner. Another group lifted the traditional way. They used 80 to 90% of one rep maximum, which is heavy weight. They did anywhere from 8 to 10 reps. That's the usual suggested method of lifting weights to promote muscle size and strength gains. And what they found at the end of the study was that both groups made the same amount of muscle size gains. In other words, the guys lifting the light weights gained as much muscle as the other men lifting the heavy weights. But there was one difference, is that the men lifting heavy weights made better strength gains. So, so it works for older people and younger people. Now, considering that how well lifting the lighter weights worked for the older people, I think that a person who, let's say, hasn't trained in years and wants to come back, as a way of, see, there's a danger if you haven't trained in years or not trained at all with weights. If you start at 50 years of age or older, there's a greater chance of injury, because your connective tissue, your tendons, ligaments, and so forth, they become stiffer with age. There's many reasons for that. They just kind of dry out with age. Again, it's kind of an inevitable consequence of aging. There's not much you could do about it. There is something you can do about it beyond the scope of this video. It has to do with substances called advanced glycation end products, which has to do with glucose deposition in muscle, which causes stiffness of connective tissue. That's a whole different topic. That's going to be covered in my applied metabolics also. But that you have to work around this limitation. And so what you do is, if you haven't trained in years or are just starting to train at over 50, I think you should use the lighter weight system, meaning, choose a weight equal to 30 to 40% of 1 rep maximum, which is lightweight. And don't fool yourself. You have to experiment. Use a weight where you could train, if not to failure, near failure. In other words, where you stop maybe 2 or 3 reps short of total muscle failure. And you do that again for about 25, 30 reps, about anywhere from 2 to 3 sets per muscle group. This will promote as much muscle growth as possible, and it also greatly probably eliminate the possibility of injuries that'll hamper your training and actually, what's wrong with my camera? Oh, okay. And actually cause you to stop training. So that's the system I'd recommend for men who are over 50, 55. What about men who've been training the whole time, like me, who've been training all their lives? Should they switch to a lighter system as they get past 50? I say yes. I did it myself because, I have problems. In other words, I have severe arthritis in both of my shoulders, and I have there's no cartilage left in my knees. So I have arthritis in my knees. I simply cannot lift heavy weights even if I wanted to. So I use the same system. I use light to moderate weights. I do higher reps, anywhere from minimal, let's say 12 to 15, up to 25 to 30 reps, especially if my shoulders, which are in really bad shape. I do 25 reps on every shoulder exercise. And this is the way I train. Again, my goals now are not to get bigger muscles, but to maintain what I have. And I can tell you that the system works very well, very well. I'm able to maintain every bit of muscle I have. Again, I'm not going to lie to you. I'm not making gains. I'm not getting bigger. I'm not getting stronger, but at least I'm not backtracking. So this is what I'd recommend for most men over 50, 55 years of age. Now, to answer the question I raised earlier about the maximum age, again, I used to think it was about 50, 55. I thought after that, no gains are possible. Again, you just can't make any gains past that age. However, some recent studies came out which just blew my mind, shocked me. They put people as old as, get this, 75 to 80 years of age. They put them on a resistance training program. And again, I don't remember the details. I'm sure it wasn't heavy weights. It was probably the lightweight system I described here. But these people actually gained muscle. Not all of them, but let's say, I don't know what percentage, but quite a few of them actually gained muscle at 75 to 80 years of age. So what the upper limit of gaining muscle is, I have no idea. But now I know I had to change my thought pattern, if you want to call it that, where now I don't say that you can't gain any muscle past 55. I say that some individuals, again, depending on, who knows, genetic circumstances, whatever, could probably still make gains well into their 7th and 8th decade, which is great news. Now, don't think that you could, don't start talking about entering Mr. Olympia or something like that, or going into, if you want to enter Masters bodybuilding competition, that's okay. Personally, I have no interest in that at all. I would embarrass myself. I competed in my 20s, and I don't look anything like I did in my 20s. I would not step on a stage, even if I got in the best shape I could. I would not embarrass myself and step on a stage at my age because, it would just be embarrassing. I look nothing. I'd probably be, in good shape for my age, but I couldn't do it. Knowing how I looked in my 20s, there's no way. Just like Arnold, and some of they wouldn't step on a stage either for the same reason, But anyway, so that's about it. I think, again, you guys out there who are, and this, by the way, goes for women too. I'm not being sex specific here. Everything I said about older men training applies to women. Women can make the same gains. Women actually have certain advantages over men. If a woman is on any type of hormone therapy, as she gets, let's say, past 40, women will actually burn fat faster than men. So there are certain, and also estrogen causes women to recover better. They get better glycogen restoration in muscle. So women actually have certain advantages, and women, just like men, can also get sarcopenia. So everything I said in this video that applies to men also applies to women. So hopefully you got some good tips. You men and women out there who are viewing this video, if you're considering engaging in resistance training, but feel that you're too old to do so, that would be a waste of time, don't think like that. You're wrong. And remember, if you don't do some form of resistance training, it's not going to be good for you. You're going to get sarcopenia, and you're going to shorten your life to a considerable degree. So that's about it. Again, I hope this has been useful for you. If you think my videos are of any use, by the way, please tell others about my channel, and also subscribe to it yourself. If you're new here, please subscribe to it. I put out new videos every Tuesday. And if you want more information about nutrition, exercise science, anti-aging research, ergogenic aids, hormone therapy, supplement science, which supplements work, which ones don't, women's health and fitness, all of this is covered in my Applied Metabolics publication. It's at www.appliedmetabolics.com. Comes out every month. It's 30 to 45 pages, no ads, no BS. I'm not trying to push any products to anyone, and I'm not involved in any supplement company. So you get only the facts. You're going to get evidence-based research. Plus, you have the bonus of my over 6 decades of constant study and experience. I'm not an armchair philosopher. I've been in the trenches. I've worked out for years. I've worked out and interviewed some of the greatest bodybuilding champions in history, dating back to Eugene Sandow. No, I'm only kidding about Eugene Sandow. He died in 1926. That was before my time. But I've interviewed a lot of the top guys and women. I know what works. It's all in my Applied Metabolics. So subscribe today. When you subscribe, send me an email. I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information about nutrition, exercise science, and general health and medicine. I also have an email portal on my Applied Metabolics webpage, where current subscribers only can send me short questions about anything they read in Applied Metabolics or anything related to nutrition, exercise that they want answers to. As long as they're short questions, please don't ask me for workout routines or steroid regimes. I don't do that. I will not. I'm not going to ever give out steroid regimes because that's unethical. You don't know the health of the person you're dealing with, and there's no actual scientifically based steroid regime that exists on this planet. Did I say it slow enough? All these guys that talk about magical steroid routines and it works for this and you're going to put on 30 pounds of muscle, that's a bunch of crap because people vary in their response to steroids. I'll just leave it at that. So again, subscribe today, www.appliedmetabolics.com. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. Just want to say just a little brief rant here. I think it's so tragic anybody that dogs have such short lives because they're the sweetest animals I could think of. Dogs are almost genetically bred to be man and women's best friend. And I mean, they love humans. They are the most loyal, loving creatures that I've ever come across. I love all animals, but dogs are really man's best friend. So, when I had my dog died a little over a year ago. No matter what kind of mood I was in, if I was depressed, bad mood, my dog would never fail to cheer me up. I mean, they're just great therapy. And when I'd walk my dog a couple of times a day, I get some of my best ideas from walking my dog. So get a dog and improve your life. You won't be sorry. Go to your local shelter, adopt a dog. There's just some wonderful, terrific dogs there waiting for you. Take care. Thanks for listening.